Today's date is Tuesday, December 9th, 2025. This is for the oral history program for the Warren County Record Center and Archives. My name is Jacob Stickle, and I'm here with
Duane Stansbury, formerly of the Warren County Health District.
Thank you for coming.
You're welcome.
And your official title is the former health commissioner.
That's correct.
Alrighty. And when and where were you born?
I was born in Richmond, Indiana, just across the state line in 1964.
All right. How'd you make it over here?
Well, I grew up in Richmond most of my childhood, and then ultimately after I graduated high school there in Richmond, and some stops and starts with what I wanted to be when I grow up, I decided to come over to Wright State University to get into a bachelor's program. I was kind of leaning towards maybe engineering or something along those lines, but one day I was in the hallway, like in the biology area, where I was taking some classes, and stumbled across this stuff on the wall talking about their environmental health program. And I read that, and that sounded interesting, and so I looked in a little more into it and talked to the gentleman that was in charge of that program, and decided to change my major over to environmental health, and ended up getting a bachelor's degree from Wright State in environmental health, and that propelled me into the career that I had in public health.
That's fantastic, and I did public history and from Wright State as well,
Okay.
So I'm familiar with the place. Did they have their own building now, if I recall correctly, or
Yes.
is it for the
They had they were there in the science building, and then I think they also got a building down in Kettering, and there's like a lab area that they've always had, and yeah.
That's awesome. And what was your experience going there? Well,
It went great. It worked out really well for me. I had to work part-time because I was sort of an adult student, and trying to work, so I didn't have a bunch of loans to pay off once I graduated.
Absolutely.
And Wright State made that really pretty easy to do. And living off campus and finding a place. Actually, I started out, there are some homes there in Fairborn where you would just sort of rent a room with, I think, like 3 other guys that would be in the other bedrooms, and you'd share everything else. And it was interesting, but it was an easy way to do it and a cheaper way to do it, until I was able to find a roommate and get just a regular type of apartment to finish out my college undergrad.
That's great. And it was just your undergrad too, really. Did it take you all 4 years? Because in my experience, I did a lot of work on the side myself because I was terrified of debt. And you took your time as well?
No, I was able to, I think maybe it might have gone 4.5 years, but it was right at that.
All right.
And I had a few credits that I transferred over from Indiana University East there in Richmond. So just a few gen eds that I'd had that helped out a little bit too.
All right. And you made it to Warren County from Wright State. Did you hear about the county from just looking up local job listings, or did you start off?
No, I did not start. I started off, I did an internship while I was at Wright State with what was the city of Springfield had their own health district. That's not the case now, but so I did a summer internship there. Then when I graduated from Wright State, I again started looking for a job, actually right before that, and came across Middletown City was looking for an environmental health specialist. At that time, they called them sanitarians. They've changed the name since then, but that's fine. And so I interviewed and was able to get that job, and which matched perfectly with what my degree was in from Wright State. And so I started working there and ended up working there a little over 10 years and progressed my way up from what was called a environmental health sanitarian in training. Then I took the state test and passed that and became a environmental health specialist. And then I was working there, continued to work there, and became their director of environmental health. And while I was there, they had a program that they would help offset some of your costs if you went on to get more education.
Fantastic.
And so I was able to use that and started a weekend program at Ohio State University to get a master's in public health. And so once a month, I would go Friday, Saturday, Sunday to learn about public health at a master's level. And that took about 2 years for me to do. I was married by that time, had 2 young kids at home.
Oh, goodness. In the nights?
Yeah.
Yeah.
And so, but it worked out well. I was able to continue to work full time. And then working with my wife and a lot of family support. I have my mom was living in the area, and I have an aunt and uncle that lived in the area, and they would help us with when we needed a little extra help with the kids.
Okay.
So I was able to pass that, and that then gave me the credential I needed. And so a couple of years later, actually what I did is I went in and told my boss that, hey, I appreciate you letting me do this. And so, but I am going to be looking for promotion now. And so I want to say maybe 6 months to a year later, I came across an opportunity to work for the Clark County Health Department, which had combined with the city of Springfield. So it was all just one health department now versus when I was an intern there 10, 11 years previously.
Interesting.
And that was with a gentleman that I knew. I had actually, when I was an intern there in Springfield, he was working for the state, and he would come in and do. He was part of their lead program, and he would come in and do lead inspections of homes in the city of Springfield, and he would ask me to come along with him and help him do those inspections, a lot of the paperwork and doing some of the measurements, and he was really nice and taught me more about the big open field of public health and what it's all about. And he ended up being the health commissioner there, and he's the one who hired me to become the environmental health director there. And so when I came there, I said, well, Charlie, which was his name, I said, I'm coming here, I'm promising you I'm going to give you 5 years, but I have my master's, and I do hope to become a health commissioner as well. And he said, okay, I agree, and so we made that arrangement. And then about 9 months later, the position here in Warren County came open.
Oh.
And so my boss called me into his office, and he said, are you going to apply for this job? And I looked at him, I said, Charlie, what did I tell you when I started here? I'm giving you 5 years, and then I will start looking. So no, I'm not going to apply for the job. And then a couple of weeks later, I came down to Warren County because the health commissioner there and the health department has always done fall education classes for sanitarians. And so I had already been scheduled and put that in to do. And I came down, and I knew that their health commissioner at the time. And I was walking in the hallways going to the next session, and he saw me and said, hey, Duane, I want to talk to you. Come here for a minute. And he did the same thing. Said, are you going to apply for what ostensibly was his position because he was the one retiring? And I told him the same thing. No, I had promised Charlie Patterson in Clark County that I was going to stay for 5 years, and then I would start looking. And he started talking to me. He probably talked to me for a good half hour, 45 minutes, about all the reasons why, how wonderful this county is, and how much he's enjoyed it. And so after, and we got done talking, I finished up with that conference, and driving home, I was like, okay, how big does that truck have to be to hit you? And so I applied, and they hired me, and then I was here for the next 21 years, and didn't regret a bit of it, and it worked out well, and things worked out well for Clark County as well, so I was happy with that. And so,
no lasting resentment from Charlie or anything?
No. He came to my retirement reception, and he's the one that made the quote speech about all the stuff I'd done, because he had known me for my entire career, and he was a great guy.
Fantastic. And he was still, what was he, was he still in Clark County, or did he?
No. Yes and no. He was still in Clark County. He was retired from public health.
Gotcha.
But now he made a foolish decision and became a Clark County commissioner.
Oh, goodness.
So he's in his first term of being a Clark County commissioner. But he grew up in Clark County in Springfield, so that's been his home his whole life, and so I think it's worked out well for him.
Good for him.
Yeah.
Too. I have a couple friends out that way from when I did my public history program that are affiliated with the Clark County Heritage Center.
Mm-hmm.
So they do good work up there, which is fantastic to see. What job? Well, we already covered what jobs you had prior to Warren County. What departments have you done? You just in the health department?
Yes, with Warren County, that's all I did. But if you want me to go back, I started washing dishes at a Holiday Inn in Kearney, Nebraska, when I was 12 years old.
For free. I wasn't aware he was going to go back that far.
Even though state law was 13, somehow I didn't have a driver's license for them to know how old I was, and so
fair, touche. How would they know?
Yeah. So I worked. So that's when and I had a paper out actually before that, but that's when I first started having a real, job where they paid you on a paycheck and stuff, and I've stayed working ever since then, and that's why now that I'm retired from public health and working for the county, that I'm just not ready to do nothing, and so I've been looking around and I've been doing a couple little things and trying to decide what's going to be the right retirement job for me.
Right. From public health specifically, I'm not sure what you would even lean towards, an advisor or being
No, I'm
teaching?
just looking for going back to being a worker bee and being a productive member of what I can do. Actually, I came here from an interview with Lowe's down in
Really?
yeah, on Wilmington Pike down in Montgomery County. So
Just something to keep you busy and not
absolutely,
necessarily
yeah,
public
yeah,
health.
yeah, right.
Is that a hobby of yours, doing anything with your hands like carpentry or?
I do a little work around the house, but I'm not real great at it, and still learning. But I know little enough to be dangerous, as the saying goes. But I can help people out as they're looking around. I think, and hopefully that'll work out too.
Absolutely.
Yeah.
I get it. I've done a little bit of work myself as a house painter.
Yeah.
It's a classic activity, but when they get me outside of painting and I'm drilling into holes and walls, I get a little
Yeah.
scared. But I'm surprised that you're not going into something like public health. I know Sinclair and Wright State are always doing their own part-time teachers or whatnot, but you seem to do a little bit of field work when you're doing lead testing in Clark County. Did you
Right.
enjoy doing that field work?
Oh yeah, absolutely, yeah, and when I was in Middletown City, I would do restaurant inspections and housing code violations. I mean, it's more related to public health, septic systems, and we didn't have a lot of wells in the city of Middletown. There was, maybe around 10 or 15 of them. Because everybody was on the city's water system, but there were some areas that had septic systems as Middletown started growing into Warren County. So we did some of that, and the other typical programs that would relate to public health. I would do any type of environmental health programs for them, and really that was a lot of fun, and I enjoyed doing that.
Fantastic. And did you do? I know you did a little bit of outreach when you were with Warren County itself, but what did that consist of for you here?
I mean, we're always looking for ways to find out how we can better help the community, and the nice thing about Warren County is we had a much stronger public health and nursing clinic presence. Part of that,
in particular, or?
no, just solely by the health department,
Ah.
because there was no hospital, and a lot of things where people get some of those ancillary type clinics are done through hospitals, but they without a true hospital here in Warren County for a very, very long time. So people getting just standard vaccinations or going to get a flu test or a flu shot. There wasn't the FQHC, federally qualified health centers, here in Warren County. There certainly were in Hamilton County, Montgomery County, in Butler County. So all those places had those sorts of things. But as this county continued to grow and grow, that became more and more of a need. And so we started doing that through the health department. And providing even some direct care services as well, which is much more unique for health departments to do that without becoming affiliated with a federally qualified health center. The Warren County Health Department has always done that through the support from the community with our health levy. We're able to offset some of those costs for people that can't afford it. Of course, we will charge the folks based off of their ability to pay and do an income assessment. Mm-hmm. And so what they can afford, we'll ask them to pay, and then the tax dollars through that health levy helps us to keep those primary care, basic needs that somebody needs to be healthy, and so they can become a productive member of the community. We've been able to do that, and that continues today with my predecessor.
Fantastic. And
Yeah.
did you ever have any issues with like getting a health levy across? Across?
No, we've been grateful to the community. They've always been very supportive over the years, and I was a little concerned. I know that there was some backlash with the COVID era, but we always focused, and we can get into that a little more, on what's right for Warren County.
Right.
And even as the health department, the state or the feds would want, these types of things, and it was like, well, what is it? What is the real need in Warren County?
Yeah.
Because I felt that was our goal. That's why we have a county health department.
Yeah.
The state and the feds provide really good guidance and information and sometimes funding, but it's our job to find out what are the needs, not just all Warren County wide, but in specific areas as well, because they are different. What's happening in Mason is different from Springfield,
Right.
different from Franklin, different from right here in Lebanon, and different in the more rural parts of the county as well. And we try to stay in touch with the community to understand that. And we don't always get it right, but we learn from the mistakes and improve ourselves as we move along. And so that's what I feel our role is, and working with the other partners throughout the community and here in the county.
Right. It's such an evolving time, especially when it went over for such a long, extended period of time than anybody intended.
Right.
Or expected, I should say.
Right.
So we talked briefly about outreach, but so day to day, what were your activities?
Working with the directors of our nursing director, our medical director, the environmental health director, which he probably had the most bad luck because that was my background as well. But I knew we had good people and I could trust him. But I would have conversations with them and working with them and making sure that what is our mission, and what are we focused on? We do a community health assessment.
Right.
Every 10 years, but it's checked on every couple of years to make sure we're still on target with what we're trying to do, and make sure that the needs of the community haven't changed so much that we need to adjust it as well. And then also, working with other partners, the other counties. I'm also the person that would go. We have with the Ohio Association of Ohio Health Commissioners. We have a Southwest region, but we also have a statewide region. I became very active with that association, and I was their president for a year as well. But that helps me to learn what other counties are doing across Ohio, and
Absolutely.
are those things that we can bring to Warren County to help some of those issues that we were starting to see here, and what can and I would take what we're doing here that might be a little different, that those other health commissioners could do as well. And it's always about continuing, because nothing is ever stagnant in public health, in personal health, in what we're doing as communities. We're always trying to grow and improve.
Absolutely.
And so that's those types of associations and my partnerships with surrounding counties helped us to continue to improve and learn what can we do better here in Warren County, and staying connected with the other agencies that aren't public health agencies here in Warren County, and talking with them, and coming to the county commissioners meeting, and they never hesitated to call me in and say, hey, Duane, what's going on with this COVID thing, with H1N1, with whatever else was happening, and always happy and wanted to keep them informed with what we were doing and why we were doing that. And they were always very supportive of us. They would question us and do the right thing for what they thought was for the community as well. And we would always find a way to what was the right balance between what we needed to do and what they were trying to do. And I think I always had a great relationship with the county commissioners, even with not directly reporting to them, because I reported directly to the Board of Health. And that was always a little different from most of the other department heads in the rest of the county. But it didn't mean that they couldn't have, they were part of the process that appointed Board of Health members as well.
Right, and I always know it was a bit different than any other part of the county, because we have a little bit of part of the Department of Health is in the basement here. I think
Yes.
it's only the financials.
Yes,
but,
yeah, because we ran out of
Oh.
space next door in the 416 building, and
Yeah, it's an older historic building. It'll
yes,
happen.
yeah,
A question occurred to me while you were talking about adjusting to and applying different behaviors with talking with people around the county. Since we have more of a rural county on the east side versus west, have you ever encountered difficulties applying health information towards, like, say, Franklin Mason, and then out towards, like, eastern side, referring to Waynesville and Harlan Township? Do you have difficulty with that?
I don't. I mean, yes and no. I mean, just there's always some degree of difficulty, but we always tried to do things where we. I mean, we always had the clinic here in Lebanon because it was centrally located, and that worked pretty well. But we also knew that didn't always reach out to areas where people had more difficulty getting to Lebanon, and so we would do flu clinics and childhood vaccine clinics in other places throughout the county as well.
Fantastic.
So if the city of Springfield or Lebanon or even Mason or even some of the township wanted to have us to come out and do a childhood vaccination clinic or a flu shot clinic, we always wanted to do that because we know that prevention is the best thing, and that's what we're all about as a health department is prevention. Once you get sick, then you go see your doctor or the hospital or an urgent care. Sometimes, and we do some of that to some degree, but not as there are other places that are designed for that, and so our focus is always about prevention. And we know that not everybody could make it to this site here in downtown Lebanon. And so we were always working with other partners, township trustees and the county commissioners and mayors and cities and the villages to say, hey, how can we come to your area? Can we set up in your building and provide these shots or a wellness clinic or whatever you think your community needs? Let's do that and make it available. And they were always wanted to have those services provided in their community, and so we would set them up on a rotation and get there when we could.
Oh, fantastic.
Yeah.
I feel like that would be a pain in the butt to offer, to get the logistics down to
Yeah.
say, okay, you're going to be here at the site for such and such.
Yeah,
Oh,
and what we were able to do recently with some funding that came from the federal government down to the state is we were able to use that money to buy what we now have is a mobile clinic van a couple of years ago.
All right.
And now that makes it a lot easier for us to expand a little bit of what we're doing. And we have several different sites where we can just set up in a parking lot of a neighborhood and go out and provide a lot of the things that we were doing, like in a community center or in a township office building or wherever. This makes it much more visible, and we still work with the same partners that we've always had, but that gives us that ability to be a little more flexible about where we can get to and provide some of those things. And we'll drive it to the Renaissance Festival when that's starting up, and get those folks all vaccinated if they haven't been vaccinated.
That is a fantastic idea because that's just a great gathering of plate where everybody's coming into, and so you could even do it like, I don't know, Kings Island or a place that's more. I never even considered that, but that's fantastic.
Yeah.
All right, and I mean to ask, the health department's always just been in that specific area in the old infirmary building, right?
Right.
And you guys are just.
And many people have said I should have been infirmed years ago, but.
I'm sorry. For the record, so we always talk about we always called it the old infirmary because that's what it was back in the day. Force of habit.
Yeah. And it's one of those buildings. They've tried to remodel it a couple of times, and it really has helped us out to be a little more efficient in how we did our clinics. Probably about 15 years ago, they really made it a nice little clinic wing for us, but. It took, when I saw some of the work, that some of the walls are like a foot thick of concrete and rebar and everything, and it's really, I would say that's probably the best built building on this campus, and it's probably the safest building to be in if a tornado should happen to blow through. Just looking at the thickness of the walls of that building, it's incredible.
I believe it. They were worried after the first two, I believe, burnt down back in the day. So
Right.
like, okay, we'll make it as fire resistant as possible, earthquake resistant,
Yep.
tornado, just
Yeah.
in case.
Yeah, and it's also nice that the other human services departments are in that same building. So a lot of our clients are going to children's services or human services to get services from them as well, and it really makes it very convenient for those families.
Good. That is a very good point because it's concerning human services
Right.
over there. Given that the new county court building was just constructed, I know people are talking about, oh, what should we do next?
Right.
Do you have a hope for if they start to like expand the human services building out? What would you hope for?
It is, yeah, and we were on the beginning of some of those conversations with the folks that are in charge of how that's happening, and it's that they've said that they're working on moving another building. I think the equipment and the people that go out into
The facilities.
the
building?
facilities building,
Yes.
and they're rebuilding that where the old jail is, and then perhaps that when that's done and they're moved over there, that where the facilities are now, that their plan is right now to put a new health and human services building on that area. And so that's probably a couple of years down the road, and hopefully that happens. I think that could bring new efficiencies into that building if they're able to do that, because there's just nothing more you can do with that building with the way it's constructed
Yeah.
to make it more user friendly. I mean, it's probably the hardest part of that building is it is not as friendly to handicapped folks. I mean, they did the best they could with what they had, and so there is a ramp, but it's really not truly ACA compliant, but it's what they could do at that time.
Absolutely, and I've gone out there to get a bunch of records and record store boxes out there using the trolleys, and
Yeah.
it's difficult making that switch back they have
Yeah.
out there.
So-
So I can only imagine somebody wheelchair bound.
Right.
Well, fingers crossed. Hopefully it goes well. Hopefully it goes well. Is there something that people don't know about your position or didn't know about your position while you had it?
I think that they're always amazed to see the breadth of what a local health department does. I mean, most people realize we do restaurant inspections, and that's sometimes the first thing that comes to mind. And a lot of people know we give vaccinations, but with the restaurant inspections, we also do swimming pool inspections. We do housing inspections, and the plumbing department is in our department. It's not with the building department. The plumbing, because the state of Ohio has always felt that could have a greater impact on health if plumbing isn't done correctly. You're drinking that water. If it gets contaminated, that can cause an outbreak. And so plumbing inspection is a part of health departments in the state of Ohio. It may be done differently elsewhere, but and so people are sometimes surprised to hear that.
Yeah, it's all preventative. Yeah.
And we do a lot of different environmental programs. Lead poisoning. We work with the state on that to have, or if a child tests positive for elevated lead, we work with them to get somebody in to do an inspection to test the house to see where the lead source might be, if it is in that house, and what can be done to remediate it. A lot, again, we're working in partnership with the state on that. We septic systems, that falls under the health department, and with this growing community here in Warren County, we have that's a huge program. And as they move further and further to the east, where it's more and more rural, it's septic systems and wells where there's not water, public water access, and when it comes to drilling a well, that falls under the regulations of local health departments as well, and making sure, again, it needs to be a safe, clean, potable source of water so it doesn't cause illness, and there's specific regulations on how that has to be done.
Absolutely, and that's interesting. I would have assumed it would have been soil and water, because
Yeah.
it just feels
Right,
you're dealing
right,
with soil
right.
and the water, right?
Yeah. And of course, we provide birth and death certificates. That's always done through local health departments. I think most people figure that out once they have a child, and so and now with statewide issuance across Ohio, you don't have to just, it used to be we just had births that occurred in Warren County. Now we have access to anything that happened across Ohio. So if you were born here, maybe you went to college in Columbus and you stayed there, or moved up to some other part of Ohio, now you can just go to that local health department as well, and which makes it more convenient for folks.
Absolutely, and easier for us to say. We always get a couple people asking for their own birth certificates. So, no, you go to help at the health building over there, please.
Yeah.
But yeah, that makes it a lot easier just to go to state, or even just doing it online.
Yeah, online, yeah.
So thank goodness.
Yeah.
We covered a little bit on how you interact with the public. Is there any that we didn't highlight yet? Like maybe public appearances or talking to, you already mentioned the commissioners, and I saw your interview briefly in March of 2020 talking to Let's Talk Lebanon.
Yeah.
Is there any other interactions with the public that you would like to highlight?
We always try to stay open to the public and to the media. That without a strong media presence here, it wasn't as regular as what it might be in Montgomery County and down in Hamilton County and Cincinnati, which is fine. But it seems like if they found out something strange was happening here, like if there was some issues at Great Wolf Water Park, and that brought a surge of media here, and so I had to answer, and there was a little bit of an outbreak with some of the slides, and we were already working on top, and we go in and do inspections and check to make sure the water quality is the way it's supposed to be. And again, this is one of those where there's some dual regulation, because the health departments do swimming pools, but Department of Agriculture at the state does rides. So all the rides, like Kings Island, the safety part of that is all done by Department of Agriculture at the state. And a water slide is a ride. So that gets regulated by Department of Agriculture. But a wave pool is not a ride, it's a swimming pool. So we go and do that. Or the kiddie pool is a pool, and so we go and do, and so but we work with them. It's just when you write, it's one of those things, when you write a state law, you draw a line. You just have to, and it doesn't always make sense the way it falls, but it.
No, not always, but it ultimately you got to draw the line somewhere.
Right. And I think that what we always try to do is work in partnership with those agencies and because it's better government when we're working together and we think along the same lines and try to do inspections in similar ways so that people understand why we're there and why we're trying to do what we're doing. And I think we always had pretty good relationships with the Department of Agriculture and the Department of Health at the state level.
Well, that's good to hear, because if anything happens to a water slide, you guys are on it.
Yes. Yes.
Do you feel like working with the public has been rewarding?
Absolutely. Yeah. I was lucky. The people in Warren County were always great to talk to. We certainly had our the calls where people weren't happy with us. But we want, I'll never say that I'm perfect or that we as a department are perfect, and we do need to learn from the things that either are perceived as wrong or that we're doing wrong. Sure. And it's always a way to improve, and so you always have to sit and listen to what is this person trying to tell me, what's the situation, and what did we do, and how can we improve what we did as an agency and as individual people that work at the health department? Because no matter what they're complaining about, there's some justification in what they did, or what they're seeing and what they felt, and so we need to get to the root of that, so the next person that comes along doesn't have that same experience.
Absolutely.
And so and of course you always have that visceral reaction when somebody complains about what you're doing. But it's take that breath and listen to them and listen to everything that they're saying to understand, and then help them to understand why you do the things, why the health department does the things they do, the way they do them, because there are rules and codes that we have to follow. But we also can't lose that human interaction, because that's what makes it really work. Right.
That's the public aspect of public health.
Absolutely. Yes. And it's a very important part of it. And I mean, everything the county does has to keep the public in mind and making sure that the public is understanding why this road has to go down this street, or this bridge has to be closed to be repaired, or whatever else is going on in the county. And the things we do sometimes make it harder on a group of people for a certain period of time, but hopefully in the end it makes everything better once whatever that is done, and makes it easier for folks to use.
Yeah. Once people get used to it, it's always to change, and
Right.
it happens.
Right.
What were some of the challenges you like to highlight that you've had with working with the public?
I think just making them understand what our role is, different from the county, different from a hospital, different from their doctor's office, and just having, again, that professional discussion with them. People, a lot, some of the nuisance complaints where your neighbor is doing something that you don't think that they should be doing, whether they're not feeding their dog or not picking up after their dog, if they're just leaving their trash out and not taking it out to the curb, or piling stuff up in their backyard. And so when you get in those situations, the person that calls you complaining about their neighbor is mad. And then when you go and visit that neighbor and take a look at what they're doing and say, well, these things that you're doing are against the county code or the state code, and you need to do things differently. Now they're not happy, but it's talking to them about, again, always focusing on the public health significance of what they've done or what they're doing, and how it can impact their health, and how it can impact their neighbor and their community's health. And most of the time people understand that, as long as it's always maintaining that professionalism with them and treating them with respect, because they're not doing, generally, hardly ever are they doing it to harm themselves or harm somebody else.
Right.
It's just, that's the way they've been taught to do it from years ago, and it's just trying to help explain a way that would make it a little bit safer or healthier for your community.
Right. And I think that's a large aspect of it, as long as you're treating it, coming at it with a place of respect, and it helps.
Right. And then we would also try to go back to that person or that neighbor that had the complaint and explain to them that, because they may be able to, that person be able to do things to get them into compliance with what health and safety say, but it's maybe not all the way that this neighbor wanted it to be, but it's still enough that that we have no more authority to make them change. But explaining to that, yes, there are some of these things that they can do, but there are some things that we corrected that could impact you and your family's health that they are working on, and we will keep checking on to make sure that has been corrected. But if your neighbor paints their house a color you don't like, we're not going to be able to do much about that.
No, not that.
Yeah. I mean, but maybe your ordinance, and there's other ways that may be impacted, but that wouldn't be the public health department.
Unless it's lead paint? Is that even your purview?
It is, but it's more done by the state at this point, and because you can't buy lead paint anymore.
Right.
But there could, especially older homes, could still have it there. And so if there's somebody doing a major remodeling, then we find out about it, we'll contact the state, and they can come out and test the house to see if there is lead-based paint on that house, and what they need to do to safely do that remediation or that repair.
Right. I mean, it happens so infrequently now. They stopped it in the early 70s, I
That's
think?
correct, yeah.
Yeah. We mentioned briefly about not having like a centralized news or public outlet, but I believe the Western Star was 2013 when it ended. Did you get a chance to work with them at all when you first started?
Yeah, they were always very helpful, and would when we wanted to get some notices out to the public, they were always very friendly and helped us to get that out. And occasionally when something was happening, they would come and chat with us, whether it was me, our environmental health director, our nursing director, our medical director, and always trying to make people aware of what the health department does and what our role was, or if they had the Western Star had a specific thing that they were working on, help explain what our role is as the local health department, and they were really good partners. Yeah.
Well, that's fantastic, and I imagine it would have been any subsequent health crises. I'm I don't want to compare it to COVID because I feel like that's H1N1 compared to COVID feels very different.
It was
difficult
different,
to
yes.
do.
But even when we had a stronger flu outbreak, which, the flu goes in circles or waves, and 1 year it'll be a mild flu, and so people don't get a severe disease, and or maybe the flu shot is, because they have to make that 6 months in advance, and so they're sort of predicting what's going to be the major strain of flu come in September, October, November, and sometimes they get it right, and that helps to keep the flu season very mild, and sometimes they don't get it as correct, and so there's a lot more people that come down with the flu, or there's a new strain of the flu that comes through that they didn't even have an opportunity to put into the vaccine, and so that makes it have a stronger, and so we'll see more people in our clinics and the urgent cares and doctors' offices, and getting them the medicines to help them to counteract the flu. So.
Right, and I imagine that you have a more of a hands-on approach of the aging community here.
Absolutely.
Too. So that would have been a large factor. Oh goodness.
Yeah, it's always the aging, the very young, and those that are immunocompromised in any way. Just something like the flu can have a much greater impact on their overall health than somebody that's very healthy.
Absolutely.
Which is why we promote healthy living as much as we can, and I mean, we've had a health educator that teaches people how to we do dietitian classes and how to prepare healthy meals, to how to exercise, and whatever stage of fitness you are, there's always something you can do to help. No matter if you're old and gray like me, and you're not going to go out and be running marathons, but there are other things you can do to even just simple walking, and even if it's just walking a block or a couple of blocks and continue to build on that. It's always those types of healthy activities, and trying to help convince people, you start small and slowly build up, and because if you do too much, anybody can overdo it, and then they're sore, and then they don't want to do it again. And so.
Yeah, and I think
so we have a lot of health education programs to help folks to understand how to get healthy, be healthy, eat healthy, and try to get those promoted out and go out into the community to do those as well.
That's fantastic. Yeah. I wasn't aware that you guys actually went out and promoted that actively. I thought it was a call and you talked about it type of deal. But absolutely, I've done house painting work for different sorts of people. Usually they're a bit older, and I would see an elderly man walk across the street, and he was shaking and what have you, and I'm like, what is going on? But he was 90-some years old, doing his rounds.
Yeah, yep.
It helps a load. It helps a lot. Yeah. And I remember. I always see the little sillier physical activities that people would promote. I remember seeing my grandmother receive a VHS copy of Tai Chi for seniors, and I'm like, that's not it'd be as useful as they just getting up and walking.
Right. Yeah, but and you never know what's going to capture that person to say, this is what I really like doing that.
Yeah.
Some people don't like just walking around the neighborhood. They want to do something different, and and it's trying to connect people with what is going to motivate them to stay active in any way, shape, or form. That's always good.
That's a fair point.
Yeah.
That's a fair point. It's whatever catches people's attention.
Right.
Are there any coworkers or managers that you've worked with that have had an impact on you? I know you've mentioned Charlie beforehand, but would you like to expand on that or talk about other people?
There's been a lot of folks that that help you out throughout your career. You can't have a 30-year plus career without people helping you. And Ohio does a nice thing of grouping health departments into regions, and we meet on a monthly basis, depending on whether we do a couple of different things. There's the total Southwest Ohio, which is just north of Dayton all the way down to Cincinnati, and almost over to like 75 or to almost to 71, and that's so that's probably about a quarter of the state. We're sort of built up into the Southwest, Northwest, Northeast, and Southeast, and in the central region in Columbus and all the counties that surround that. But then we also break the Southwest into two regions, which is the Dayton region and the Hamilton region, Cincinnati region. And because we straddled the fence, because with the way Warren County is, a lot of people in the northern part are more affiliated with Montgomery County, work in Montgomery County, and in the southern part it's more Hamilton County and Cincinnati. I always felt that we need to be partners with both of even those smaller little central region and the southwest region, and so we would send people to meetings to both of them, and when they were having some sort of special event, we'd be a part of that, or if they were doing some targeted thing that we always worked well with both regions, smaller regions, and because it was about if it means that I have to spend another hour a month or a couple meetings a month in Dayton versus Cincinnati, but I can offer programs to people to the northern part of the county, whether it's here in Warren County or just over the line into Montgomery County, and they're getting healthier and doing things to make themselves healthy. We're going to do that because that's the right thing to do for the people of this county, to give them as many opportunities to make a healthy choice for their life and their family.
Absolutely, because they can either come in here or work or go out and work. People are very mobile. Right,
and we're all very busy, and so if I have to spend an hour or 45 minutes driving to get to where something versus 10 minutes, I mean that makes it change people's minds and maybe gets them to do something that they wouldn't have done if they had to drive all the way, and vice versa. So whichever way they're going, so.
Makes a big difference.
Yeah.
Do you have a favorite part of the job when you first started, and did it change through your tenure?
I think that one of the things that I had to learn most when I came here was the breadth of the clinic presence that we had here in Warren County, and like I said, it's for other than health departments in the bigger cities or bigger counties that have a federally qualified health center present, we probably have one of the larger clinic presence of a health department our size or smaller, and most of the smaller health departments don't have all the clinics. They'll do the prevention clinics where they're giving prevention vaccines, childhood vaccines, flu vaccines, and those sort of things. Almost every health department does that. But when it came to child physicals for children going into school or going into sports, or sick child visits, or we even have an adult clinic because they didn't have many places to go to if they were not feeling well or sick. Mm-hmm. And so we've always had a good, strong senior adult health clinic, especially if they're at an age where they haven't quite got into Medicare. There can be a gap there for them with insurance as well, and so we would provide some help with them that way. And so that's something that's a little unique for Warren County versus other counties our size or smaller. And then we can also refer them to other places if it was something that we didn't do. So that was something I didn't know and appreciate until I came here and learned more and more about it. And it's really what was really great to learn and know is just how passionate those nurses and those folks working in those clinics are about the people coming in to get those services, and making sure they understand what the significance is and what they can do to help improve not just coming to our clinics, but some lifestyle choices and changes they can make to live healthy lives day to day, and healthier food and those sorts of things, and having a dietitian in our health department, helping them understand how those things help them lead healthier lives. So that was really interesting to learn and helpful for me and great for our community.
It's a big difference, and not everybody can hire their own dietitian.
Correct.
Did you appreciate this another aspect of the health department in recent years, or did you always really appreciate the clinic that you had?
Yeah, I think that we what we always tried to understand what was happening in our community and growing with what was changing. As different areas of the county grew faster, and what can we do to make sure that we can either extend services to those areas or make sure they're aware of the services that we're providing. Working with, again, other county leaders, and seeing how we can work together with other programs or things that they were wanting to do, but also working with the cities and the townships. There was plenty of times where somebody would call a mayor or a township trustee would contact us saying, "Hey, we're thinking about doing something like this for our community. Can the health department come and join and provide some of these types of services?" And those were always great hits. It helped us to get out to the community and brought more people sometimes than when we were just going out by ourselves. If a community was having sort of this outreach where they were bringing lots of different organizations and county or local offices together to provide some services, then you get a bigger show of the public coming and have a stronger impact. And so working with some of those folks was always rewarding, because we knew that it was going to be a bigger hit than us just doing something all by ourselves. But we would do that, but when we could work with other partners, and we had some of the best partners in Warren County, that I'll always be grateful for all those folks that helped me and the health department through the years.
Would you like to name any of them? You don't have to.
Yeah, there's so many. There was a lot of great people that helped us through the years.
Fair. That's the thing. The sum for 21 years. Are there any memorable projects you like to highlight that we didn't already highlight?
I think we covered most everything. So yeah, thank you for asking those good questions.
No problem. What are some of the highlights you've had with the county that we didn't go over? I know that's the other part is some of these questions just are pretty open-ended, so
Right.
they just might lead into everything else. So.
Right.
Are there any other specific highlights you'd like to mention?
I appreciate again, the other agencies here. The county commissioners have always been welcome to us, and they would contact me if they wanted. They had some questions, or somebody reached out to them asking about what the health department did. Yeah. They always came to us and with knowing that we were going to answer their questions and would work with them, or if they had something special they wanted us to work with them. They were always great partners, but so were the other all the agencies here. The county garage serviced our vehicles as well, and we had a great relationship with them, or the county administrator, he or she, whenever they were always very helpful for us, and we could talk with them. So we've had a great partnership with, being a pseudo separate agency. We knew that most of the community didn't understand or see that, and so it was always best to, if somebody thought we were a county agency, that's fine. It didn't bother me that because we are a county agency, just not necessarily under the county commissioners, but we had to work with them in a lot of different ways, and all the other agencies that are here, to make sure the community is getting all the services they need. And everybody that with Warren County was always gracious with us as the health department, and we hope that they felt the same way from us.
Yeah, it was the same mission, the
Right.
same goal.
Absolutely. Absolutely. We're all here trying to provide needed services to the community.
Fantastic. And what was the county like when you started versus now, would you say? This has been 2004 is when you started?
Around there. And obviously a lot of changes, a lot of growth, and will continue to grow. And I think that it had gone through. It had already been growing for a while as well before I came here, and so I knew that was going to be part of the program when I got here, and it was not. And again, to continue to allow the health department to grow with that, and not prevent the growth, but make sure we were growing in a strong and healthy way, and providing that type of feedback, and seeing how we as an agency needed to grow. As we would see different. We had a group of Somalia that moved into the community, and I can't remember what they came here for a specific reason, but then with one of the major businesses, and then that business, and I can't remember which one it was, went under, but so many of those people stayed in the community, and then they didn't have health insurance, and we were helping to provide some health care for their children and the elderly that needed those, and just different, and the Hispanics that would come in that were, again, helping with the building and the growth of the community. A lot of them didn't have insurance when they first got here, and their families didn't, and making sure they were up to date on any vaccinations and making sure that they understood some healthy lifestyles and providing that sort of thing. So that was always, and so we had a Spanish translator in our clinics to make sure that program and that made it easier for them to access childhood vaccinations and those sorts of things.
Interesting, yeah. As the county grows, that'll happen.
Right.
People see opportunity here and they come in. And I wasn't even aware of I don't want to call it a contingent of Somali people coming in, but I was just surprised to hear that that even happened.
Right.
Well, that's fantastic.
Yeah.
And would you like to? So I have this line here. Did anything significant happen during your time in county government? I suppose this is the opportunity if you want to talk about a bit of a retrospective on COVID or on H1N1, or I even noticed there was Ebola was mentioned. Even a newspaper referenced a TB outbreak briefly. What was that? 2018, I think.
Yeah, and we've had minor little outbreaks like that across the time, and that's part of what we do as a local health department is tracking disease occurrence. Any time somebody gets tested and it comes back positive, those results are sent to the local health department, and so we have epidemiologists that are looking for any types of trends, and if it's just a one-off, hey, that they obviously got treated if they were tested, and so but we if we felt we needed to call them and check in on them, we would do that. But if we started seeing multiple, and if they were clustered in a certain area, then we started putting a team together to look at what do we need to do, contacting the state health department. Is this just happening here in Warren County? Is it happening elsewhere?
Right.
Contacting the other local health departments next to us, asking them what they are seeing, and work. And then we can work if we can work together. It's just amazing the partnerships that are there for us as a local health department within the county that we have to rely on, but also outside the county with our other health departments that we would send people to other health departments as well if they were having an outbreak, if they needed a couple nurses because they were having a flu outbreak just in their area. Yeah, we can do that. So it's all about partnerships, and because there are outbreaks that occur in just certain areas that don't, and if you can get enough people there in quick enough time, it can prevent the spread to across a county or outside of a county.
Absolutely.
And it's a value to all of us to be able to work together that way.
Yeah, even some work experience that the nurses might achieve on that area. I wouldn't have considered that. Is there a time distance that you put on yourselves? Like, if it's more than 2 counties away or anything like that?
Typically that sort of worked out by itself that because they, so if it was Montgomery County or if it was Miami County, which is just north of there, they would be reaching out to the closest counties because they know that those folks can get there sooner. So you sort of, as an outreach, when you're the county that's experiencing, you go to your closest partners, and then if you need more, you start you're spreading those ring circles further out until you've addressed everything. So it sort of is built into the way we seek help.
Interesting. I wouldn't have considered that.
Yeah.
Given how would you like to discuss COVID at this time? It's given in retrospective because I know you had a couple media appearances around that time. Is there anything you'd like to highlight about about what occurred?
I think that we tried to treat it, as this is, it was an unknown.
Yeah.
When we first heard about it, nobody really knew. There was no vaccine, but we know that it was, spread by sneezing, coughing, and proximity. Just it's very similar to a flu or a common cold virus or anything like that. And so we focused here, and I think a lot of health departments did, on educating people of this is how this is what we know about it today. This is what we know. This is how it spread, because it's from sneezing and coughing, and so you can protect yourself the same way you protect yourself from the flu every year or from a common cold. So if you, and especially if you're a person that is immunocompromised in any way, or you are elderly, or you catch a cold easily, these are the things you can do to protect yourself. But you make those choices for yourself. I know that I always knew that in a county of 230,000 people, the state can make a mass mandate or a mandate that everybody gets these vaccinations, but the reality is you have to explain things to people and convince them that this is the best interest for them and their family, and then they will act to do that. And if you can't make that argument good enough for that person, you're not going to convince them to do it. And so they've made a conscious decision. We've given them the information as we know it, and if they make the decision to not wear a seatbelt, we've got a lot. We've had a lot of studies that show the dangers of not wearing a seatbelt. There's still people that don't wear a seatbelt, I'm sure.
True.
But if somebody asks me, yes, it will protect you. Yes, it can. Put us. If you get in a crash, you can put a rash on you where the seatbelt is. But you didn't. That's not as bad as some of the other, health impacts you can have if you didn't have that seatbelt on.
Right.
So it's just trying to give people as much information so that they can make a decision with all the facts that we can give them. Again, they're going to make the decision based on what they think and what they know, and that's and hopefully and for the most part it does work out. I mean, some people will get sick that could have been prevented, but luckily they're healthy enough that they can survive that, and it's okay, and that's okay too, and so we just tried to educate and provide any supplies that they would need, and vaccinations when we had them, and if you could come and get it, great, and if you chose not to, that's fine too.
Yeah, and people are going to make their own decisions.
Absolutely.
That's just how people work.
Right.
Yeah. And I believe during the really early stages of COVID, I remember hearing you made comparisons to H1N1. Would you say that that's still valid now, or not to be? Yeah.
Right. I think it's one of those. It's degrees, and H1N1 was a more virulent strain of the flu, and COVID was probably a little more virulent strain of a similar type flu type of thing, but probably and impacted more people than what H1N1 did. And it's just, and hopefully the next one isn't as bad. And if there's a different strain of the flu or a different viral disease that starts to spread in our community or our state or our country, and it's just, I think that's probably one of the key goals of our health department, and I think of all health departments, is healthy living. And and it's true, if you can lead a healthier lifestyle, if your weight is controlled, you do some exercise, even if that's just walking on a regular basis, and keeping yourself and your family healthy, whatever is, you will have a much greater chance of surviving or not getting as sick or not getting sick at all.
Right.
The healthy you are and your family are. And so, that is always going to be the number one focus of the health department, is helping people find the best way they can be healthy and lead a healthy life.
Absolutely.
Yeah.
Would you say other significant events aside from outbreaks like the recession from 2008, did that affect you guys much?
Yeah, not as much, but I know that there were more people that were out of a job, and that made them have a need. Maybe they didn't have insurance, and maybe they would come to our clinics to get some vaccines or bring their kids to get vaccines, or if they got sick, they would come here. And so I was glad that we had those resources, that we could provide those services for them. But it luckily, and one of the great things for us is, again, this county has always very much supported the health levy, which helped us to be able to provide services when, as the economy does its swings.
Yeah.
We had some level funding, so we could continue to provide those basic services to the community as the economy went up and down.
Mm-hmm. Which is fantastic.
Absolutely.
And everybody loses their position and they have to, yeah.
Mm-hmm. Right.
What are some of the most important things you've learned working for Warren County?
That understanding that you do have to remember that people live different lives than I do, and I can't think that they are going to react or respond exactly the same way I do. Mm-hmm. And it's just learning, and they're throughout Warren County, people are different. People in Springfield are different from Waynesville, are different from wherever else. And that's what makes this country great. That's what makes Warren County great and Ohio great, is the differences make us stronger. Mm-hmm. But there are times that you forget that, and when you're interacting with somebody, and you have to, and even I said, okay, Duane, take a breath, and first listen to what that person's trying to tell me, mm-hmm. and understand that they have a different life that I have, and all I can do is listen to them, understand what their questions are, and then explain what we do as a health department and what we can offer them, and then it's their choice as to whether they want to use our services or do something else, and that's fine. And not everybody wants to vaccinate their children, and that goes in circles, but I still believe that that's one of the best things we can do for our children or for our elderly is to vaccinate them. But if somebody chooses not to, that's their personal choice, and they're welcome to have those choices. But we will still continue to provide them to folks that want them and need them, and explain the benefits and the side effects of doing those things. Whether they get the vaccination or whether they don't, mm-hmm. both have positives and both have negatives that you have to be aware of to make a good decision for you and your family.
All right. You just need to come at it with understanding and just to, I think, listen to people.
Absolutely.
I think people tend to forget that sometimes, right. And you just need to, understand.
Yeah. We all get emotional, and myself included, and so we get passionate, and that's a great thing, passion. But we also have to remember to listen to the person we're talking to as well.
Absolutely.
My wife and kids remind me that of it on a daily basis.
They help.
Yes.
What advice would you like to give to any current Warren County employee?
That this is a great place to work, and learn, find out what your niche, and be the best employee you can be, and whoever you're working for, whatever you're doing, focus on giving the best services you can, but also listen to the people that you're providing those services to, so that their voice is heard, and so that that whatever you're doing for the county, if you're not listening to the folks that you're providing that service to, they may not be getting all the full effect of that service, because you're not communicating well. So just be open and listen, but also be willing to communicate why you're doing the things you're doing, and understand, and be willing to accept the fact that not everybody is going to agree with you.
Yeah. I think that's well advised.
Yeah.
Is there anything else that you would like to add, any additional information that we didn't touch on?
I don't think so. You did a nice job.
Well, thank you. I appreciate that. And, thank you for coming by and sitting down with me, especially in retirement. I appreciate you being able to pick up the phone and say, hey, why not?
I'll send you my bill.
Oh, well, all right. Well, this concludes that. Thank you for coming in.
Oh, you're welcome. I'm
This'll-
happy to do it.
I appreciate it. And this will conclude the oral history. Thank
Okay.
you.